We are deeply honored to have with us the former First Lady of the United States, Ms. Rosalynn Carter. In addition to her exemplary service as our nation's First Lady, Mrs. Carter created and chairs the Carter Center's Mental Health Task Force, an advisory board of experts, consumers, and advocates promoting positive change in the mental health field. Each year, Mrs. Carter hosts the Rosalynn Carter Symposium on Mental Health Policy, bringing together leaders of the nation's mental health organizations to address critical issues. During the Carter administration, Mrs. Carter became active honorary chair of the President's Commission on Mental Health, which resulted in the passage of the Mental Health Systems Act of 1980. Welcome, Ms. Carter. It's a great privilege to have you with us today.
Mr. Chairman and members of the subcommittee, thank you for the opportunity to speak to you this afternoon about this legislation that is so important to so many people, millions in our country, parity in insurance. I have been working in the mental health field for, I don't like to say it but because it ages me, but for over 35 years. That's a long time. When I began, no one understood the brain or how to treat mental illnesses. Today, everything has changed, everything except stigma, which still holds back progress in the field. But today, because of research and our new knowledge of the brain, mental illnesses can be diagnosed, they can be treated effectively, and the overwhelming majority of people living with these diseases can lead normal lives, being contributing citizens in our communities. Today, I join many individuals and hundreds of national organizations calling for an end to the fundamental stigmatizing inequity of providing far more limited insurance coverage for mental health care than for treatment of any other illnesses. And again, I join forces with my friend Betty Ford in urging prompt action on this important issue. Betty and I have lobbied many times for this legislation and for care. I have now a very good mental health program at the Carter Center. Annually, we bring together leaders to take action on a major mental health issue. We have focused many times on stigma and discrimination and the importance of ensuring adequate, equitable coverage for people with mental illnesses. To me, it is unconscionable in our country and morally unacceptable to treat 20%, at least 20% of our population, as though they were not worthy of care. We preach human rights and civil rights, and yet we let people suffer because of an illness they did not ask for and for which there is treatment. Then we pay the price for this folly in homelessness, lives lost, families torn apart, loss of productivity, the cost of treatment in our prisons and jails, and I could go on. I have always believed that if insurance covered mental illnesses, it would be all right to have them. This may be the reason stigma has remained so pervasive, because these illnesses are treated differently from other health conditions. All mental illnesses are potentially devastating. In my 35 years, I have seen so many advances in knowledge about the brain and improvements in treatments. I urge the subcommittee and sponsors to ensure coverage of all mental illnesses as defined by the DSM-IV, instead of treating some conditions as high priority over others. We had an intern at the Carter Center, for instance, this past spring, who suffered from obsessive compulsive disorder and depression. And when she was in high school, she once spent 2 solid weeks in her house, not able to leave or to be with her friends. I'm happy to say that she received treatment, is a college graduate with Phi Beta Kappa honors, and just got a job here in Washington with the Ad Council. Without resources and support, she could still be sick and shut in her home, which is what happens to so many who do not get the help they need because they can't afford to pay for services. Our country loses all the many contributions of these wonderful people. Through the research of people like Howard Goldman and Richard Frank, we know that parity in insurance benefits for behavioral health care has no significant increase in total cost when coupled with management of care. We also know this from a number of enlightened companies, such as AT&T, Delta Airlines, Eastman Kodak, General Motors, and IBM, and others, which have provided comprehensive coverage for their employees. Tom Johnson is one of my good friends. He's the former publisher of the Los Angeles Times and former CEO of CNN, and he has struggled with depression. He and two other prominent CEOs in the Atlanta community who have experienced depression have had an enormous impact on mental health benefits offered by businesses in the Atlanta area. I'm so pleased about that. In the last few years, there have been several major reports released. The first ever Surgeon General's report on mental health, President Bush's new Freedom Commission on mental health, and the Institute of Medicine included mental and substance use conditions in the series of reports on the quality of American health care. All of the reports reinforce the statement that effective treatments are available, but that most people who need them do not get them. The nation has learned a lot about the importance of mental health issues through Hurricane Katrina and the needs of our returning soldiers and National Guard troops. We support our troops in the field, and it is critical that we continue to support them when they come home. One other issue, many states have moved ahead with parity. These have been long-fought battles, with some states managing wonderful successes. It is so important that any federal legislation not preempt any of these gains. Well, we finally have mental health parity legislation in sight. This committee has worked long and hard to bring this legislation forward. It is an example of what can be accomplished with strong bipartisan support. When this legislation is passed, our citizens will be healthier and our nation will be stronger, more resilient, and more productive. On behalf of the millions of people affected by mental illness and substance use disorders, I applaud your efforts. The benefits to our nation will be enormous. Thank you.